And we begin tonight with breaking news on the coronavirus pandemic and the blunt assessment from President Trump about the tough week ahead, warning there will, quote, be a lot of death. The U.S. today crossing a new threshold, more than 300,000 cases nationwide, more than 8,000 deaths. After revealing the state's single deadliest day, New York's governor reporting the apex in cases could come within 7 days. And the state is, quote, not ready. New York City hospitals nearly maxed out. COVID patients now being taken to the makeshift hospital with 2,500 beds at the Javits Center. The NYPD losing another member, a 26-year veteran and a school safety agent. New Jersey's governor saying his state has now lost nearly 100 more people than it did on 9/11. And tonight, one of the president's top health advisors warning the three hottest areas in the U.S., New York, Detroit, and Louisiana, will reach their apex in the next 6 to 7 days. ABC's Trevor Ault leads us off.
Tonight, President Trump warning the nation.
This will be probably the toughest week between this week and next week. And there'll be a lot of death, unfortunately.
And telling Americans there will soon be more COVID-19 hotspots.
They come and they hit you like you got hit by a club.
Already getting hit, New York, the Empire State bracing for the worst. Governor Andrew Cuomo now saying the apex of coronavirus cases is likely 7 days away and warning his state is not prepared.
It's good that we're not at the apex because we're not yet ready for the apex either. We're not yet ready for the high point.
Many emergency rooms like this one at Mount Sinai, Queens, already pushed to the brink. The state of Oregon offering 140 ventilators, the Chinese government sending 1,000, the shipment arriving today at JFK Airport. Governor Cuomo signing an executive order allowing medical students who were slated to graduate to start working right away, plus 85,000 medical volunteers, 22,000 of them from out of state, serving as reinforcement on the front lines. And New York City's Javits Center, just converted to a hospital, will now treat patients with COVID-19.
That is a big deal because that 2,500 bed facility will relieve a lot of pressure on the downstate system.
The last 48 hours, New York's deadliest. 630 deaths Friday, 562 Thursday, bringing the total statewide to more than 3,500 lives lost. At this pace, a person is dying from COVID-19 in New York every 2.5 minutes. The president announcing more personnel will be deployed to hot zones, including 1,000 medical military personnel headed to New York City.
They're going into war. They're going into a battle that they've never really trained for. Nobody's trained for this. Nobody's seen this.
This is what's going on in Bellevue. They're making portable morgues. This is my life. This is our life.
Hospitals have been using these refrigerated trucks to store the bodies of COVID-19 patients because the morgues here in New York City are almost already full. But these mobile morgues are filling up themselves to the point the Department of Defense is now sending 85 more of them to New York City. Nearly every state in the country has now been declared a public health disaster zone.
This is going to be like having many Katrinas. This is going to be a reality where you're going to have many cities simultaneously, many states simultaneously in crisis, needing healthcare professionals, needing ventilators. There is no national structure to address this right now.
Louisiana's governor now extending his stay-at-home order until the end of the month, warning the state's hospital system may soon be over capacity. This convention center in New Orleans prepping for patients and an extra 200 ventilators from the national stockpile on the way. Of Louisiana's 12,000 COVID-19 cases, more than 400 have died, a higher death toll per capita than New York City.
We haven't even hit halfway.
At Los Angeles Cedars-Sinai Hospital, emergency room doctors and nurses comparing their care to combat.
This is a battle zone. I mean, it's a medical environment. It's loving, it's caring. But we have an enemy.
California's governor addressing the state's backlog in testing.
I'm not going to explain away why we didn't do more and better. All I can say is we're going to do more and better.
At one point, nearly 60,000 Californians were waiting for their results. Now 13,000 are still pending. New Jersey's Governor Phil Murphy ordering all flags in his state flown at half staff, opening his news conference with a moment of silence, saying more New Jerseyans have now died from COVID-19 than on September 11th.
Please let that sink in for a moment. This pandemic is righting one of the greatest tragedies in our state's history.
The president urging all Americans to wear a face mask anytime they go outside. Officials say those daily decisions to protect against the spread will further protect those on the front lines as they brace for tough days ahead.
All right, Trevor Ault joins us now from the Javits Center here in New York, that makeshift hospital that will be treating COVID-19 patients. Trevor, just before we came on the air, Dr. Deborah Birx, who's on the coronavirus task force, saying there are 3 areas that could hit their peak cases in 6 to 7 days, those areas being New York, Detroit, and Louisiana.
That's right, Tom. Dr. Birx says those locations have already been hit the hardest, and they're all still on the upswing in terms of cases and deaths, expected to roughly peak at the same time about a week from now. But even beyond New York, Louisiana, and Detroit, she says the next 2 weeks are critical for the entire country, and went as far as to say if you want to protect your family, now is not the time to go out, not even to the grocery store or the pharmacy. Tom?
The surge is coming for those areas. All right.
Pharmacy. Tom?
The surge is coming for those areas. All right, Trevor, thank you for that.